My name is Dr. Krazee. I am going to teach you how to learn and memorize the cardiac medication. I come from a family of my mother's name is so crazy and my father's name is Ben Crazy and my name is Betty Crazy. So you remember that we are going to learn about cardiac medication. It is very important for you to learn. There is very many medication to learn, and I am going to help you learn how to memorize the medication for cardiac because it is very important. And we are going to have an exam tomorrow. You must learn. You must learn. You will get the exam tomorrow. You must get the 90% or you go. You go. Okay, this is the first thing we must learn is the different ways to memorize the cardiac medication. So Dr. Krazee is going to teach you how to memorize the medication for the cardiac so your blood pressure doesn't go up and you don't get into the first type of medication you must learn is called ACE inhibitor. It is used to treat hypertensive and heart failure. Most medication that is ACE inhibitor and in letter PRIL. Pril, like lisinopril, captopril, lisinopril, enalapril, benazepril, pranapril, ramapil, clonopil, tenalapril. ACE inhibitor. Remember, if it lands in pril, it is ACE inhibitor. Another type of medication you must learn is statin. Statin for simvastatin. It is used to lower cholesterol level. Most medication name that end in statin is an anti-lipidemic medication. Atorvastatin. All kinds of statin. Okay, the next kind of medication Dr. Krazee is going to teach you is benzodiazepine, which is a medication to help a muscle relaxant and a sedative. Most medication that end with the letter PAM, diazepam, lorazepam, clonazepam, temazepam, flurazepam. Dr. Krazee needs benzodiazepine, but Dr. Krazee said he don't need benzodiazepine because benzodiazepine make him too relaxed and slow him down. Dr. Krazee had too much to do. Another type of medication that is used to treat hypertension, angina, dysrhythmia is a beta blocker. Remember, beta blocker. It ends in LOL. The beta blocker ends in LOL. Atenolol, propranolol, metoprolol, corvodaplam, bisoprolol, netoplam, tamolol, lepidoplam, acebutolol. Okay, you know beta blocker is end in LOL like atenolol. Another important medication that Dr. Krazee wants you to learn is calcium channel blocker. Calcium channel blocker is used to treat hypertension, angina, and dysrhythmia. That's right, it is used to treat hypertension, angina, and dysrhythmia. It ends in pine, P-I-N-E, pine. Pine means channel calcium blocker. For instance, nifedipine, amlodipine, belodipine, isradipine, nasodipine, nimodipine, nicardipine. Another cardiac medication is nitrate. Nitrate produces vasodilation and it is used to treat angina. Most medication names contain the letter N-I-T-R. Nitroglycerin, nitrostatin, nitrate. Another medication you must learn is thiazide diuretic. It is used to treat hypertensive and peripheral edema. Most of this medication name ends in the letter Z-I-D-E. Zide, chlorothiazide, triclomerithiazide, hydroflumethiazide. It is important that you understand thiazide diuretic. Thiazide, you know thiazide diuretic has zide in it. So the medication that this is talking about will have zide. Another important medication for you to understand is thrombolytic medication. It is used to dissolve clot information. Most of this medication ends in the letter ACE. Even though it ends in ACE, A-C-E, it is not ACE inhibitor, but it ends in ACE. I don't know not why they did not make these medication names to follow ACE inhibitor, but they got it backwards. This is a thrombolytic medication. Altoplase, retoplase, tenectoplase, anistotoplase, streptokinase. Okay, you know, understand. Thrombolytic medication ends with ACE, A-C-E. And Dr. Krazee must warn you when you take medical exam or you take a nursing exam, you must know the generic name for the drug. They do not care much about the other type of name, so you must memorize the generic name more important than the brand name. Okay, the first medication we're going to talk about is treatment of hypertension. Hypertension is high blood pressure. The goal of therapy is to lower the blood pressure. There is the diastolic pressure. We want to make it less than 90 mmHg or less in systolic pressure. Systolic pressure, we want to go to less than 160 mmHg or less. Lifestyle modifications are critical. What I mean when I say lifestyle modifications are critical is you need to get off the couch. You need to get off the couch. You need to get off your behind. Then you will not your behind and you do not exercise and walk and eat a good diet, you will get hypertension and you will have to come and see Dr. Crazy. Medication classification used to treat hypertension include thiazide and thiazide like diuretic, loop diuretics, beta adrenergic blocker, alpha adrenergic blocker, central acting adrenergic inhibitor, peripheral acting adrenergic inhibitor, antidiuretic converting enzyme inhibitor, ACE inhibitor, a calcium channel blocker, and a vasodilator. And if you do not think you have enough energy to exercise now before you have hypertension, you just wait till you take these medications. It will slap every bit of energy out of you. Thiazide and thiazide like diuretic action inhibit the reabsorption of sodium in the distal tubia, extracellular fluid and potassium, thus reducing cardiac output. We want to reduce cardiac output. Remember thiazide and thiazide like diuretic reduce cardiac output. Examples: diuryl, chlorothiazide. Okay, you can learn the diuryl, but it is more important to learn chlorothiazide. Hydrodiuryl. Remember hydrochlorothiazide. Remember we talked about this before. If the medication is thiazide, then it is going to end with the zide. And then another medication is Zaroxylin, metolazone. And thus in consideration, you must remember this is monitor the electrolyte. Teach need for increased dietary or supplemental potassium. Another medication you must learn that the Dr. Crazy recommend is beta-1 adrenergic blocker. Beta-1 adrenergic blocker. This will prevent sympathetic stimulation of the heart. Remember that, sympathetic stimulation of the heart. It will block the beta-1 receptors in the heart muscle, thereby decreasing, slowing the heart rate, forcing of the heart contraction, reducing blood pressure. Dr. Crazy forgot to take his beta-1 adrenergic blocker today. Oh, forget it, I got too much to do. No, sympathetic stimulation of heart is caused by the release of epinephrine and norepinephrine, which increase heart rate and vasoconstriction of arteries, avoiding patients with any degree of heart failure because heart failure will become worse. Therapeutic uses. Okay, you want to use this medication during banana. To eat lots of banana. Dr. Crazy say eat lots of banana and drink lots of water and get off your behind and exercise, because you do not want to come and see Dr. Crazy. And Dr. Crazy is very expensive. Okay, beta-1 adrenergic blocker. Its therapeutic use is to manage angina pectoris and acute MI. MI is myocardial infarction. Hypertension, anti-hypertensive is what it is. Okay, beta-1 adrenergic blocker example. Do you remember what Dr. Crazy say adrenergic blocker end with? Yes. Do you remember what Dr. Crazy say adrenergic blocker end with? You better know. You better remember. It end with LOL. Propranolol, which is Inderol. Lopressor, which is metoprolol. Atenolol, Nadolol, Labetalol. A generic name always end in OLOL or LOL. LOL. Nursing implication is assess the heart rate and the blood pressure before giving. You do not want to give without checking the heart rate and the blood pressure. If you call me about this medication and you did not check the heart rate and blood pressure, Dr. Crazy, who will get really crazy. Assess the heart rate and blood pressure before giving. Withhold medication if the heart rate is less than 60 beats per minute. Oh, why would you do that? Oh, you know why you would do that? Because you do not want to lower the blood pressure any more than 60 BPM per minute. Or if systolic blood pressure is less than 100 mmHg, administer with food. Do not stop taking this medication rapidly. Remember the LOL beta-1 adrenergic blocker. Dr. Crazy say do not stop abruptly. Okay, like I say, a calcium channel blocker. Another medication that is required for electrical excitability. Dr. Crazy like electrical excitability, but this calcium is required for electrical excitability of cardiac cells and contraction of the myocardium. Calcium channel blockers inhibit calcium ion influx or movement into cells or myocardial and arterial smooth muscles, both cardiac and peripheral. Calcium channel blockers dilate coronary arteries and arterioles. They relax the vascular muscle and arteries and allows the vasodilation, decrease peripheral vascular rigidity PVR, and decrease heart rate. That's what they do, and it's used for angina. You heard what I I say angina, hypertension, and dysrhythmias. Remember calcium channel blocker. Now can you remember what calcium channel blocker ended? You must learn this. You must know this by tomorrow. Yes, most channel blocker, most calcium channel blocker, and then pine. And if you do not take your calcium channel blocker, you will end up in pine. A pine box, that is. Okay, cardizem, cytosem, procordia, corcordia, generic name is nifedipine, calon, isopan, verapamil, elipapine, Norvasc, you see that many times in cardiac. Norvasc mean amlodipine, and remember, and in pine, it is calcium channel blocker. Okay, you want to do this when monitor heart rate and blood pressure before administering. Hold if systolic blood pressure is less than 90 or heart rate is less than 50, and guess what? Oh, no grape juice for you. Oh, Dr. Crazy say, no grape juice for you. Too bad. The next cardiac medication Dr. Crazy recommend that you understand is anti-coagulant. Anti-coagulant prevent or delay blood coagulation and are used both to treat and prevent thromboembolic disorder. Heparin. Remember that heparin inhibits conversion of fibrinogen to fibrin, thus prevents formation of a fibrin clot and clotting cascade. You must monitor PTT or APTT. Dr. Crazy say thromboblasted time or APTT should be 1.5 to 2 times the control normal range to be therapeutic. Monitor for HITT, heparin-induced thrombocytopenia, antidote for heparin overdose, protamine sulfate, Remember that. Dr. Crazy say you must understand these medications because you will be tested tomorrow. Example of anti-coagulant is Coumadin, which is warfarin. Prevents conversion of vitamin K, which is a clotting factor, by decreasing its production in the liver. Dr. Crazy said monitor PT, which is prothrombin time. Levels are used to maintain at 1.5 to 2.5 times control value. Monitor INR, international normalized ratio. Levels range from 2 to 3. 2 for DVT, 3 for PE. Antidote for Coumadin overdoses. Vitamin K, which is aquamethadone. Okay, you must remember, Dr. Crazy will have to come and see Dr. Crazy. And Dr. Crazy is Dr. Crazy is expensive. More example of anticoagulant is Coumadin. Foods high in vitamin K such as liver, cheese, egg yolk, leafy vegetable, broccoli, cabbage, spinach, kale, and oils, peanut, corn, olive, and soybean, and cranberry should be avoided or used sparingly while on Coumadin. Another medication is Lovinax, which is enoxaparin. Monitor platelets, and some physicians monitor INR as well. Hold Lovinax if platelets are less than 100,000. Arixtra, Fondaparinux inhibit its clotting cascade, and you must also, when you take Arixtra, Fondaparinux, to monitor platelets, and if they are less than what? I just told you, you better know. 100,000 do not administer Arixtra, Pradaxa, which is dabigatran, a new drug used to lower the chance of stroke in people with atrial fibrillation. Antiplatelet agents prevent or disrupt aggregation, a clumping of platelets needed to form a clot, used to prevent a preventive any treatment for clients with a history of MI, which is myocardial infarction, stroke, and cardiac surgery. Block certain enzyme pathway to prevent clot formation. For instance, aspirin, which is acetylsalicylate, Plavix, clopidogrel, ticlopidine, persantine, dipyridamole, prosthetic mechanical heart valves. Efiant prasugrel is a new drug. That's right, Efiant prasugrel is a new drug, and probably very, very expensive. The next class of drug you must learn is antidysrhythmics. Classes of antidysrhythmics include class 1, that lengthen the refractory period of cardiac contraction. Example, procainamide and quinidine. Class 2, beta blockers, reduces SNS, stimulation to the heart. Class 3, prolongs repolarization in refractory period, treats ventricular fibrillation. The example is amiodarone, paridone, paraxarone. Class 4, calcium channel blocker, prolonged resting period of heart. Example is verapamil. ACE inhibitors, angiotensin converting enzyme inhibits. ACE inhibitors, class of drug used in the treatment of hypertension and CHF. ACE inhibitors inhibited renin and angiotensin aldosterone mechanism by blocking conversion of angiotensin to 1 to angiotensin 2 and prevent peripheral vasoconstriction under the PVR. Examples of generics often end in pril. Remember that ACE inhibitor. I told you this before. You must remember ACE inhibitor end in pril. Captopril, lisinopril, ramipril, enalapril, loop diuretic in Lasix and Bumax. Lasix and Bumax are loop diuretic. Stool softener or laxative prevent straining to have a bowel movement. You do not want to strain to have a bowel movement. You could have a heart attack, Dr. Krazee. Recommend you do not sit on the toilet and go because you could have a heart attack. You do not want to do that, so you get stool softener or laxative to prevent straining and having a bowel movement. Other medications that are used to treat MI or thrombolytics, they dissolve blood clots in the blood vessel. They must be used within 1 to 6 hours of onset of symptom before necrosis result. Activase, alteplase, tissue plasminogen activator, TPA, retavase, loop diuretic. Remember that. Lasix and Bumax, stool softener, stool softener. You do not want to sit on the toilet and go because you could have a heart attack and you could come and end up coming see Dr. Krazee, and you do not want to see Dr. Krazee. So anxiolytics, antiemetics, analgesics, and morphine sulfate IV used to treat MI. We will also talk about percutaneous transluminal coronary angioplasty, which is PTCA. We'll talk about that later. But then another way to treat the MI is stents placement in an expandable metal mesh tube that is implanted at the site of the blockage in the coronary artery during angioplasty. A thoracotomy, KCABG, cabbage, 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 cabbage. You do not want cabbage. You should eat plenty of cabbage so you do not have to have cabbage. Cabbage coronary artery bypass graft. Get off your behind. Get off your behind and do not be a computer potato. You know, like couch potato, computer potato. Patients with severe heart failure, cardiogenic shock, or life-threatening arrhythmias may require infusions or stimulating drugs or mechanical support of heart function with an intra-aortic balloon pump. Low sodium diet, advanced to low fat, low cholesterol. Quit eating all that fatty food. Dr. Krazee say, stay away from Kentucky Fried Chicken. Dr. Krazee say, stay away from McDonald's. You want a low sodium diet, advanced to low cholesterol, low sodium, and no coffee. Oh, I know that really gets on my nerves because Dr. Krazee like caffeine. Dr. Krazee love caffeine. Fluid restriction, avoid smoking. Dr. Krazee don't smoking or nothing. Dr. Krazee smart. Must stress that CAD is a chronic disease with no cure. Once you get cardiac arrhythmia, you will coronary artery bypass. You do not want CAD. It is a chronic disease with no cure. Lifelong changes are the only way to slow after the progression. So you must get in the treadmill. Get on the treadmill and watch the computer. Get on the treadmill and watch football. Or get out there and play football yourself. Get off your behind or you will come see Dr. Krazee. And you do not want to come and see Dr. Krazee. If you do not listen to Dr. Krazee, you may get peripheral arterial disease. And the treatment for peripheral arterial disease would be a thrombolytic agent, urokinase, anticoagulant like what? Heparin, Lovenox, Coumadin. And if you do that, you don't get to eat the good stuff anymore. Antiplatelets, ASA, Plavix, Persantin. And these medications are so expensive because we like to take your money because you lay on your behind. A therectomy, high-speed rotary burr, scrapes blur, plaque out, arterial bypass surgery or grafts, femoral bypass. It will cost you a lot of money. PTA, which is percutaneous transluminal angioplasty, a balloon and stent placement, laser-assisted angioplasty laser probe, advanced to site 2 occlusion and stenosis, and atherosclerotic plaque is vaporized. Amputation, that's right. You might get your leg cut off by Dr. Krazee, and you don't want to have your legs cut off by Dr. Krazee with amputation, and then they call you starve. You do not want that. So before that happens, you must stay away from fast food. You must get off your behind. Listen to me, Dr. Krazee. Know what Dr. Krazee is talking about. Oh, and then that Dr. Krazee must warn you that you will have complication maybe. You may have complication of arterial occlusive disease, which include tissue atrophy, infection, ischemic ulcers, and gangrene. You do not want a gangrene for the acute arterial occlusion by thrombus or embolus. If you do not, you will have gangrene, and you do not want gangrene because if you think you sweat when you walk 1 mile, you have no idea about sweat till you get a gangrene. Dr. Krazee tell you the truth. Bypass graft occlusion occurs within the first 24 hours after surgery. Compartment syndrome. Consider emergency tissue pressure with a confined body space becomes elevated and restricts blood flow, resulting in ischemia, can lead to tissue damage and death. As signs and symptoms would include tingling, numbness, worsening of pain, edema, uneven pulses, and fasciotomy. Okay, for the medication used to treat dysrhythmias is anti-coagulant, anti-arrhythmics, cortisone, baserone, inhibit ventricular dysrhythmias, atrial fibrillation, and atrial flutter. Motag and cardizem inhibits atrial fibrillation and atrial flutter. That's right, the Motag and cardizem inhibit atrial fibrillation and atrial flutter. Atropine and isuprel treat bradycardia. Bradycardia mean your heart is going too slow. Atropine will help your heart to speed up. And isuprel, atenolol, decrease myocardial contractility. Low-pressure artopril or metoprolol treat sinus tachycardia, PAC, atrial fibrillation, PVC. Norvasc, amlodipine, pine. You must remember what the end in pine mean. Decreases cardiac contractility, sinuses, tachycardia, atrial fib, and atrial flutter. And there are even more medication to treat dysrhythmia. Anti-dysrhythmia include lanoxin or digoxin. Digoxin slow the heart rate to sinus tachycardia, atrial fib, and atrial flutter. Another one is adrenaline or epinephrine, cardiac stimulation, systole, ventricle tachycardia, ventricular fibrillation, bradycardia. Another one is dopamine, increases cardiac output and blood pressure, and that is used for bradycardia. And so that is using IV infusion. Do not use cocaine because that is illegal, even though that would increase cardiac output and blood pressure because it encourages dopamine in the brain. Drug therapy, treatment for heart failure, drug therapy. If you have heart failure, you will get the drug therapy. Drug therapy include angiotensin converting enzyme inhibitor. And guess what? Anti-angiotensin converting enzyme inhibitor stands for ACE inhibitor. ACE inhibitor. These are considered a standard for heart failure, vasodilators, plus a diuretic to decrease afterload and decrease cardiac hypertrophy. Inhibits the active of angiotensin converting enzyme, which converts angiotensin 1 to angiotensin 2. A powerful vasoconstrictor inhibits the stimulation of the hormone aldosterone, which promotes retention of sodium in water. That's right. And remember, what is ACE inhibitor? And you must learn these medications. You must know that ACE inhibitor and then pril, P-R-I-L, pril, like enalapril, lisinopril, quinapril, fasanapril, rampapril, captopril. The other genetic name is, or the brand name is Vasotac, Prenavil, Acupril, Monopril, Active, Altase, Capoten. But this, remember, the generic is enalapril, ACE inhibitor, lisinopril, ACE inhibitor, quinapril, ACE inhibitor, fasanapril, ACE inhibitor, raminafril, ACE inhibitor, captopril, ACE inhibitor. Dr. Krazee say you must remember the pril mean ACE inhibitor. And there are even more medication to treat heart failure. Angiotensin 2 receptor inhibitor blockers. They act as an antagonist to angiotensin 2 receptor of vascular smooth muscle, blocking vasoconstriction effect and aldosterone effect, thus inhibit H2O and NA retention, thus lowering the BP. What does BP? Blood pressure pressure. And guess what? They end in and. Remember that angiotensin 2 receptor inhibitor blocker end in losartan, candesartan, valsartan, irbesartan, tan. Angiotensin 2 receptor inhibitor blocker, tan. Remember that ends in tan. The brand name is krazee, Etacan, Diovan, Avapro. But it was important to remember the genetic. The brand name is losartan, candesartan, valsartan, irbesartan. Remember angiotensin 2 receptor inhibitor blocker, tan. Remember, and in tan. Then the next drug you must remember for heart failure drug therapy is a loop diuretic. These are very potent diuretic. They will make you go to the bathroom really bad. A potassium wasting drug to decrease fluid overload. Do not give to sulfur allergic patients. And these medications you know are Lasix, Bumex, and Demodex. But they must remember the generic for the heart failure drug therapy loop diuretic, and then what? It ends in IDE, like furosemide, bumetanide, torsemide, loop diuretic, You must remember Dr. Krazee tell you thiazide diuretic. That is a other diuretic is thiazide. And guess what? The diazide and then the medications that are thiazide diuretics, guess what? They end in zide, Z-I-D-E, like hydrochlorothiazide, or also known as HCZT, hydrodiuryl chlorothiazide. Decrease the fluid overload. So they loop diuretic are like furosemide and bumetanide, block sodium and potassium reabsorption, rapid acting, and they cause profound diuresis. Diuresis means you pee your pants. That's right. You would pee your pants if you did not take the loop diuretic. You would be hooding inside. Okay, you must monitor electrolyte, especially potassium. Dr. Krazee say there are also potassium sparing diuretic. They remove sodium and extracellular fluid, but they maintain retention of potassium. Then you don't need to eat as many bananas, okay? They do not need to eat as many bananas. Example, diurenium, triameterine, aldactone, spironolactone. You must monitor electrolyte. Give after meal to decrease nausea, because these may make a person feel nauseous. There are more medication for heart failure, and you must take these medications possibly. Another medication is the beta-adrenergic inhibitors, blockers. They reduce sympathetic nervous system input with decreased heart rate and improves cardiac output. For example, Corvada. Remember that beta-adrenergic inhibitor, and then what? LOL, metoprolol. Triple XLopressor is metoprolol. Codag is corvedilol. LOL, beta-adrenergic inhibitor, LOL. Beta-adrenergic inhibitors, blockers, LOL. And inotropic cardiac glycoside increases the force and contraction of the myocardium, which increases cardiac output. It slows heart rate to reduce workload of the heart. It controls atrial fibrillation if present. An example is lanoxin, which is also digoxin. Remember that inotropic digoxin, inotropic cardiac glycoside, digoxin. Another one is a vasodilator, and they decrease afterload, which increases cardiac output and reduce cardiac workload, used for patients that can't not take ACE inhibitor. Remember, the vasodilator is used for a person who cannot take ACE inhibitor. An example of a vasodilator is isobid or isodeal, isosorbide, vasodilator, isosorbide, isobid, isodeal. And then the one that you go to maybe take potassium supplements, like another potassium supplement is K-Dur, potassium supplement K-Dur. Dr. Krazee say you must understand digitalization after patients are given a loading dose or high dose of digoxin, cardiac glycoside leukocyte inotropic when therapy is started, and we must observe for toxic symptoms of digitalization and VND, irregular pulse, slow heart rate, anorexia, and visual disturbance. Blood levels of digoxin are monitored. That is very important. Blood levels of digoxin are monitored. Dr. Krazee say as soon as the therapeutic blood level is reached 1 to 10 mg/ml, the patient is put on a maintenance dose. Hypokalemia predisposes patient to digitalis toxicity. Hypokalemia. Digoxin has a greater effect on the AV node than the SA node. Digoxin has a greater effect on the AV node than the SA node. So if you are asked by Dr. Krazee, which node does digoxin have the greater effect? Does it have the greater effect on the AV node, or does it have a greater effect on the SA node? You better answer the Dr. Digoxin has a greater effect on the AV node. Epogen, procrit, erythropoietin, hematopoietic growth factors. It is important to stimulate erythrocyte, leukocyte, and platelet production, also used to treat anemia and post-chemotherapy. Epogen, procrit, which is erythropoietin, hematopoietic growth factors, stimulate erythrocyte, leukocyte, and platelet production, also used to treat anemia and post-chemotherapy. You must remember that, Dr. Krazee. Repeat several times so you will get it in your head. Neupogen, filgrastim, colony-stimulating factor. It is used to produce a rapid increase in the number of neutrophils. Neutropenia, neutrophils. It is used to produce a rapid increase in the number of neutrophils. What end is it? Neupogen. Remember, neutrophils kind of sound like Neupogen. Neulasta, filgrastim. This is a colony-stimulating factor, and it is used to increase the number of neutrophils after chemotherapy. Numega oprelvecin, used to stimulate the production of platelets for clients at risk for thrombocytopenia caused by cancer and chemotherapy. Remember that one too. So remember, if you do not want to have to come and see Dr. Krazee, that is Betty Krazee, who is a heir to Ben Krazee and Soul Krazee. You do not want to come and see Betty Krazee. Dr. Betty Krazee would have to put you on cardiac medication, so you must remember these cardiac medications. Thank you very much for your time, and you must pass the exam tomorrow, or you will get to the end of the